And we begin this half hour with the news that the Prime Minister, Boris Johnson, has now been discharged from hospital. As we've been reporting for the last few days, he's been treated here at St Thomas's Hospital in London, and he's been paying tribute to the NHS staff who've been treating him for coronavirus, saying that he owes them his life. Let's speak to our correspondent, Helena Wilkinson, who is at the hospital for us. We knew, Helena, that he was recovering, he was doing well, but this will be excellent news for obviously friends, family and his colleagues.
Yes, we've had that statement from number 10, Martine, in the last few minutes or so, confirming that the Prime Minister has now left St Thomas's Hospital here, which is less than a mile away from Downing Street. He's been in hospital for a week. Just to read you the statement from number 10 Downing Street, the Prime Minister has been discharged from hospital to continue his recovery at Chequers. That's the Prime Minister's official country residence in Buckinghamshire. The statement continues, on the advice of his medical team, the Prime Minister will not be immediately returning to work. He wishes to thank everybody at St Thomas's for the brilliant care he has received. All of his thoughts are with those affected by this illness. So in the last couple of minutes, confirmation from Downing Street, the Prime Minister has been discharged from here at St Thomas's Hospital. He spent a week in hospital. He came on Sunday, we know, as a precaution, we were told, because his symptoms continued to persist, in particular that high temperature, and things then developed very quickly for the Prime Minister. On Monday, we were still being told he was working from his hospital bed, getting those ministerial papers. Then by the evening, on Monday evening, the Prime Minister then was transferred to intensive care, which was a shock to everybody. And there was obviously grave concern, as there would be with anyone who is transferred to intensive care. That, again, we were told was as a precaution, so he could be near a ventilator. He didn't need a ventilator. However, he had what was described as standard oxygen treatment throughout his stay here, and he stayed 3 nights in intensive care. But now we have that confirmation. The Prime Minister has now been discharged from the hospital here. He has thanked the medical team who have given, as he says, excellent care to him, and he's gone to Chequers in Buckinghamshire. That's his official country residence, so he hasn't returned to Downing Street, and he will be out of action for some time, although it's not clear as to exactly how long that will be.
Number 10 said earlier, didn't they, they didn't want us to speculate on how long it will be until he was back in charge. And in the meantime, it's the Foreign Secretary, Dominic Raab, who is leading the efforts against coronavirus.
Yes, that's right. The Foreign Secretary continues to be making those decisions, and the Prime Minister will need time to recover. No one knows how long that's going to take. He will obviously be continuing to take advice from his doctor in terms of his recovery. And we heard, didn't we, a couple of days ago that the Prime Minister was able to make short walks here in hospital. That just gives you an indication of just how seriously unwell the Prime Minister was. But every patient differs in terms of how long their recovery takes. I think crucially the Prime Minister didn't need to go on a ventilator. That would have been, of course, much more serious for him and would have taken him longer to recover from. But he is going to be based at Chequers. No doubt he will be monitoring what's going on, having conversations with colleagues, but he isn't going to be working as such. And Dominic Raab, as you say, the Foreign Secretary, continuing to be in charge and making those decisions.
Helena, for the moment, thank you very much. Helena Wilkinson at St Thomas's Hospital in London. Well, our political correspondent, Jessica Parker, is here. So, with Dominic Raab still in charge, and we mustn't expect the Prime Minister to be back at work fully for quite some time, it means then that the Cabinet, led by Dominic Raab, will be in charge of this review of the lockdown measures when it comes.
Yeah, review due this week. It was the Prime Minister who originally talked about this 3-week timetable from when the lockdown measures were brought in. And as Helena was just mentioning there, Dominic Raab, the first Secretary of State, as well as the Foreign Secretary, but it's that title of First Secretary of State that means he is effectively the Prime Minister's deputy and was asked to deputise for Boris Johnson when the Prime Minister was admitted to intensive care. So he will be in charge of the government this week, as it looks to whether to continue with the lockdown measures. I'd say the mood music in terms of whether that's going to continue. The expectation is that the lockdown measures will continue. I think these daily briefings that we've seen, whilst health officials and ministers have said that the social distancing measures are having an effect, it's still time to bear down on the virus, try and cut transmission rates, and of course that way save lives.
When anyone is diagnosed with having coronavirus, particularly if they have pretty severe symptoms, as the Prime Minister clearly did, those close to them hold their breath. That's no different with Boris Johnson, not least for Carrie Symonds, his fiancée, who of course is 7 months pregnant.
Yes, absolutely. And it was interesting on Thursday evening when we learned that Boris Johnson had been taken from intensive care back to the ward at around the same time, around 8 p.m, when the clap for carers goes on. People across the country go out onto the streets and applaud those frontline staff who are obviously putting themselves at risk in the fight against coronavirus. Carrie Symonds tweeted this picture of a rainbow and applause symbols on social media, clearly joining in with the clap for carers, but perhaps also a hint there of how grateful she was to the care that the Prime Minister had at St Thomas's. And indeed, we understand that Boris Johnson has been telling friends that he believes he owes his life to those doctors and nurses who were there at St Thomas's Hospital during his stay. And something we heard from Downing Street earlier this week was that when he was moved from intensive care back to the ward, he was waving his appreciation to those workers as he was moved. So clearly, as Helena was saying, Boris Johnson did become very ill, did begin to show severe symptoms. Initially, of course, we were told he had a temperature in particular. He was doing those self-shot videos from Downing Street. And it was on Sunday evening that he was admitted as a precaution. Then the following day that he was admitted to intensive care. And what was the concern over that period was the persistence of those symptoms, that they had lasted beyond that week period. So I think a lot of people will be very pleased that the Prime Minister, who will, I'm sure, return to work at some point, but that he's out of hospital and that his recovery continues.
I suppose, though, it's highly likely that by the time he comes back to work, Parliament will be sitting again in some form, because it's actually not many days away.
No, 21st of this month that Parliament is due to return. And it's interesting, there have been calls today from Sir Keir Starmer, the Labour leader, to make sure it does return in some form. I think it's very unlikely you are going to see MPs from across the country travelling down to Westminster, going into the House of Commons chamber, which is pretty small when you get all of the MPs in there, for obvious reasons, because they wouldn't be suitably socially distanced. We know what is being looked at is a possibility of some kind of virtual parliament. They've been doing something similar in the Welsh Assembly, for example. My understanding is that's going to be discussed further this week as to how that might work, whether you might see a limited number of people on the estate, whilst other MPs across the country can engage somehow virtually. But as I say, expect to see more details this week. And I think that what opposition parties have been saying is that they think it's important that they can scrutinise the government's handling of coronavirus as we move forward.